I thought, I can't do that. Like, I can't put the marriage before anything. It's great that we do these things as moms, but then think about the extra energy that takes out of us. We didn't know the danger that we were in, and we had to try to get off the mountain.
Welcome back to another episode of the Unspoken Words Podcast, a Selective Mutism podcast by the Smart Center, produced and published by New Edition Productions. This episode features a discussion between Dr. E and Janeen Herskovitz. Janeen is a licensed mental health counselor in the state of Florida and owner of Puzzle Piece Counseling, LLC. She earned her bachelor's degree in special ed from Rowan University in New Jersey and her Master of Arts in Mental Health Counseling from Webster University. Janeen is also trained in EMDR therapy and is a certified autism specialist. She has been married to her husband Joe since 1995, and together they have 2 autistic young adult children. Janeen runs a group practice, Puzzle Piece Counseling, which is located in Jacksonville, Florida, which helps neurodivergent families live more peaceful lives. Her podcast, The Autism Blueprint, covers a variety of topics surrounding autism in the home. In this episode, Dr. E and Janeen discuss the importance of parental self-care, emotional dysregulation, how downtime is a prerequisite to overall well-being, and more. Before we get started, if you have any questions on anything you hear in today's episode, please head to selectivemutismcenter.org/ask Dr. E, that's ASKDRE, and enter your question. The team reads all of your submissions and does their best to answer them on podcast episodes, blog posts, and on social media. Speaking of social media, for the best of this episode and every episode of Unspoken Words, make sure to follow the podcast on Instagram and on YouTube. On Instagram, we are unspokenwords_podcast, and on YouTube, we are Unspoken Words Podcast by Dr. E. All right, without further ado, please enjoy episode 50 of the Unspoken Words Podcast.
Hey listeners, before we get started, I want to tell you about Communicamp, our 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. It's over 16 hours of parent education and support, as well as 16+ hours of treatment for your child or teen. Spaces are limited and spots book fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice. Okay, now enjoy the episode. Hello, listeners. It wouldn't be me if I didn't start out with saying I am super excited for today's episode. I am honored to have Janeen Herskovitz. She is a licensed mental health counselor in the state of Florida. She's also the host of the Autism Blueprint podcast and her website, thepuzzlepiececounseling.com or .org?
It's .com, puzzlepiececounseling.com or autismblueprint.com. I'll take you to the same place.
Oh, perfect.
Yeah.
So again, this is great. And this topic is wonderful. We are going to be talking about parental self-care. How important is that?
Oh my gosh. Huge, right? You know, from your work and from mine as well. It's a huge issue.
And something that just gets so overlooked and undervalued that our families come in like such a focus on treatment for their child, their teen, or themselves, they forget to take care of themselves.
Oh, 100%. So I have a private practice in North Florida where we help special needs families, neurodivergent families, families dealing with autism and broad neurodivergence, selective mutism, obviously. And that's one of the things that I get the most pushback on too, is when I ask a parent, like, what are you doing for you? When is time for you? And they usually laugh.
No, for sure. It's like, wait, I didn't think of that. I don't have time for me.
Right. Who has time for that? You're going from therapy to therapy and, and then when you're home, you're trying to deal with your child or your children, right? You're trying to help them in whatever ways you can. So they always come first.
Right. And navigating the whole family dynamics. One of the things when I was like researching your work, and I was just like amazed, like you and I have a lot of similarities. The biggest similarity is we're both mama bears to an individual that's struggling. For mine, it was my daughter, Sophie, who struggled with selective mutism, and you with your son with autism. that led you to this career like me.
Yeah, 100%. My son is now 27 and he's living at home with us. He is minimally verbal. He does some speaking, some typing, and some writing to communicate. So it's sometimes really difficult. He has apraxia. So for him, autism hit us in a really big way, and he was diagnosed when he was about 3 years old. And that was back in 2001. So at that time, I was pretty alone. I was pretty on my own. The internet was fairly new, so I spent a lot of time on there, but there wasn't like there is now, right? So,
No, it's the same timing for me. My daughter Sophie was, entering preschool and didn't talk despite her talking at home. And many of our listeners know my story, but I was the same way. I felt incredibly alone. I was getting told she had everything and anything under the sun, where it was not describing my child. And that's where I started with the Selective Mutism Association and started that organization as a means of one, bringing awareness to what this is, but also helping people like not just know the term, but what to do. And back then I didn't have this, I wasn't doing what I'm doing. Obviously, I was a family physician specializing in more children and anxiety. I always had such an interest in anxiety and so forth. So it's like interesting that it all came full circle for you, came full circle for me, and we dedicated our career to this because we as parents and professionals really kind of knew what others were going through and we didn't want them to struggle, right? I mean, was that part of your motivation?
oh, 100%. I hit the ground running with the diagnosis. I'm one of those people. I'm a Jersey girl by heart. So even though I'm in Florida now, but you can't take the Jersey out of the girl. So I was like, hit the ground running, man. Whatever we got to do to fix this, right?
Yes.
Thinking I was going to be able to fix this, and I crashed and burned. I had, my son was 3 at the time. I had a new baby, my daughter Rebecca, who had, issues as well, different issues, but still issues. And it was just, it was devastating. It wasn't even on my radar. I was a special education teacher by trade. So the universe does have a funny sense of humor, but this was not what I signed up for for my family. This, my career was fine, but for my family, that was going to look, the way I wanted it to look. And when it didn't, I crashed. I had a combination of anxiety, depression, and post-traumatic stress, all of that. And, at the time as a young mom, you're just questioning everything that you're doing. And this was my firstborn. So I just felt like, well, everybody else must know better than me. So I just kept, taking him to different doctors and and it was funny too, because he had a regressive form of autism where he was developing, I want to say normally, but as I look back, it wasn't really quite typical development. And speech was difficult to get. So when I got the diagnosis, it really just hit me, like blindsided me, because this child was so smart. He was spelling his name on the refrigerator at 18 months old, and his name is Benjamin Herskovitz. So I didn't make it easy for the poor kid. Yeah. So, but he was reading at an early age, and he was doing all of these things. So as a parent, the first thing that you do is say, what did I do wrong?
Of course. And that's what a lot of our families are going through now, as especially the newly diagnosed. What did I do wrong? How did I not recognize this sooner? And going to professionals that often really, either see this in a different way. They don't really see their child. That's what we hear a lot, with selective mutism being a social communication anxiety disorder, and that social communication piece, we do have a rather large percentage of individuals in our practice that have autism. They have the ability to speak because they're selectively mute, but in settings, and we're going to talk about it, like the sensory piece, right? That's often a reason why many of them do shut down in that social puzzle they can't figure out. But parents are so focused, at least for this diagnosis, on trying to get their kid to speak without realizing what may be causing them not to speak, and then addressing that and in understanding, the environment and how that affects them. So this self-care is so important, because what I'm hearing from you, and just from your own experience, which is what so many families go through, it's so energy draining, because you have to give so much to not just your child, but holding your family together.
Oh my gosh. Yes. Then that's really a good way to put it. My emotional and just energetic bandwidth was like sucked out of me every day.
Because you're either working with your child, taking them, like you said, to therapy, putting dinner on the table for your family,
Mhm.
dealing with your other children that have needs, your spouse, your partner, whomever. And what about you?
Right, right. And so I remember at one point when my kids were little, we're kind of going along, going through the motions, a different therapy every day. My husband was a teacher at the time, and he would come home and be nonstop as well. And so we had at one point I had a therapist for me, my husband had a therapist for himself, my son had about 5 or 6 different therapists, and then we had a marriage therapist. And at one point when we were just really, the marriage was really not doing well, we just said, you know what, we have to triage this, we have to prioritize. And we actually took my son out of therapies for a little while when he was about 6 or 7 years old, just so we could focus on the marriage. And when we did that, I got to tell you, Dr. E, it was like, I thought, I can't do that. Like, I can't put the marriage before anything, because if I do, what if he regresses? And what if I can't get him out? And so I just want to encourage parents out there, if you're afraid of what I was afraid of, don't be. Your child's still going to be there. They're still going to, you'll still be able to, do all the things you need to. But if you as a parent, or as if mom and dad are not okay, kiddos are not going to be okay.
So much sense. I think, one of the first things we can talk about is that, which is what you're, talking about, that emotional load, and managing your own anxiety in this process. What were some of the things, like you said, you felt anxious, depressed, like that emotional piece, your emotional barometer
Oh
is
yeah.
often off the chart.
Yes. I mean, I at that point I was having panic attacks. I was not eating because I'm one of those women that when she gets anxious doesn't eat rather than eats too much because my stomach won't let me.
Oh, interesting.
So I had to really get to know myself. I remember the first therapy session that I went to, because my husband, who had been in therapy most of his life for different reasons, was like, you need to go see a therapist. And I thought, no, I don't. It's probably my thyroid. It's probably this. It's probably that. It turned out I was severely depressed at the time. So when I went and got help for that, and the therapist asked me, what do you enjoy doing? I couldn't answer.
Oh, wow.
I had no roadmap for, like, well, what do I like to do? I had completely lost myself.
Oh, yeah, that is so common.
Yeah, so I had to really figure out, like, well, what do I like? Like, so I mean, I got involved in doing yoga. I started, going to at that time I was involved with a church that I got more involved with and things like that. And it really helped to have my own thing separate from the family, from the autism, from the disability. I needed kind of a little bit of an identity of my own, so I loved that I could go to yoga class on a Thursday night and say to my family, okay, you know what? This is what mommy does every Thursday at 7. Good luck with dinner. You guys will be fine. Whatever happens while I'm away is okay. So I had to let go of being a control freak.
Yeah, no, it's hard, especially when you have the kind of personality that you're describing. And I'm very much about like trying to figure it out. I'm like, I guess that's why I went into medicine and I went into osteopathic medicine because it was always about figuring out the whys of a patient. And I was just like obsessed with why. And I think that's become the hallmark of my of my career of why. So all that energy of why. And when you see families like you're probably very similar to me. Like every time I see a family, 110% of my attention is on that family. That's emotional. So I take breaks throughout the day as I'm working with my clients because I need to recharge to be ready for the next family. So you're
Yeah.
always giving your own child, and in our case, our patients. But it's no different for parents that work and they're giving it to their job in whatever way it is that they're giving. So I think the emotional load and navigating the children's or the teens, whomever you're working with, a lot of kids with SM, it's those other whys, like the sensory piece that is common amongst your population with autism and SM. A lot of kids have sensory challenges and managing that kind of like what it takes to manage that for them to help them navigate this, like you're going into a supermarket, like so
Yeah.
many families walk in, get what they need and leave. For someone with sensory needs, which in your case, autism, and a lot of our patients, that's such a navigation in itself. That's so stressful for you to just get through the supermarket.
Yes, yes. And and it's so important. I'm glad you brought that up because learning about my son's sensory needs and my daughter, 'cause they both have sensory needs, helped me realize my own and how much those sensory needs are linked to your emotional state, right? So once I realized, okay, if I'm speaking to my son and the TV's on and the lights are on and the fan's on and the air conditioning's running in the background, maybe in the microwave, there's all these sounds and he can't isolate his hearing to the point where he can hear what I'm saying with all those sounds, even though you and I can, right? So I had to learn how to, if I was going to ask him a question, to give him a cue, to turn down, to mute the TV, and obviously let him know I'm going to do it, because if I do something and don't tell him about it and it catches him off guard, he could have, an emotional meltdown. Now, not so much. Now he's adjusted and gotten, better with things like that. But so now to this day, when I ask him a question, I immediately kind of scan the room to see what's going on, to see what he might be distracted by.
No, you just said it. Like what I'm hearing from you, which is something I was going to say, is you're always on. When you're
Yes,
dealing, right? You're always on. You're looking
100%.
around like, oh no, I can see in there. It's super crowded, super loud. That's not going to be a
Yes.
great environment. So for us, when we're practicing our exposure goals, we don't go to Target at 2 o'clock on a Saturday when it's overwhelming, when it causes a lot of shutdown. We
Yeah.
will pick, maybe we will go to Target, but we'll go during off hours and how to adjust it. But the amount of energy it takes to be able to figure this out, to set the world up for our kids is just
Yes.
so draining for so many parents.
Oh, 100%. A few years ago, we decided that I would go into my practice full time and my husband would leave teaching and be 100% with Ben, my son. And it was the best decision we ever made because I've been running the ship, all these years. And so now it was his turn. So the transition was fun. He's always been a real involved dad. We'll be married 30 years this May.
Oh,
So
good for you.
thank you. It's been a lot, but it's wonderful, and we love each other now more than ever. But he would take my son to this barbecue restaurant near us every like Saturday morning or Sunday morning, whenever it was. As soon as they opened, like 11 o'clock, they were the first ones in. And they sat at the same table every time with the same waitress every time. So what we did was we could do that exposure, I love that word for it, to be as successful as possible.
Absolutely, because that gives the children confidence.
100%. And it was great. It was beautiful.
And the repetition, I have to say, I want to bring these pearls in. Like
Yes.
for us, the same 3 or 4 restaurants, the same 3 or 4 stores. You go during off hours, you create your visual scripts, whether it's written words or visuals. All of that minimizes their need to think and process, how you ask them a question, how you bring them into the social communication encounter. All of these things, creates a sense of safety for these kids.
Oh, I love that. Yes, a sense of safety. And that safety comes not only from the environment, but from your interaction with them. So I always make sure I say to my son now that I know him really well, that I'll say, okay, I always give him two choices. We're going to go out to eat. Do you want to go here or here? Do you want to eat this or this? Not a whole list of things, but if I can whittle it down for him and then present it. And yeah, so that's it. It's great that we do these things as moms, but then think about the extra energy that takes.
I mean, just with what we just said, like it's exhausting to think about all that you need to do to set these exposures up. And there are families that will call the center and be like, I really don't have time for this. We had someone recently call the center and said, we need our son cured. This is exact words. We need our son cured. I don't have time. I work full time. I'm a single father. I cannot do any of this. And we said back, this may not be the right fit for you because this is going to take parent involvement and facilitation. And, we can't cure your son on the spot because that's what he wanted. Like it doesn't work that way. This is a
Right.
living, breathing human being that has needs, and
Yes.
we need to, as parents, be there to facilitate, to create the exposures, to know how to help them and support them and practice this because they're not going to be able to do it on their own.
100%. Yeah. And I was that parent in the beginning. I was like, just tell me what I got to do. I'll check it off the list. We'll do it. And then we'll move on. We'll be okay. And
Yeah.
then, he'll go to college someday or whatever. I just wasn't, it was my own way of denying what was going on. It was my
I
own
think that's
grief.
what it is.
Yeah. So that grief cycle is important because anytime you find out something's wrong with your child, there's grief.
You just gave me a whole nother podcast topic to talk about, just to give as I think about that. I mean, there's so much to talk about, but that, learning about the diagnosis and being able to manage your own, grief over it and acceptance over it. And every now and then when we have families that come to us for selective mutism, and then you see them and you realize, whoa, they have some additional challenges, like learning issues, that everyone was blaming it on SM, or you see autism and you're like, we recommend this testing, and no, I don't want it. And then sometimes they'll have it, you give them the diagnosis and they will not accept it because they're in denial. And as a result, their children are going to suffer. School-based accommodations, interventions need to be adjusted, and their parenting needs to be adjusted. Everything needs to be adjusted.
Yes. These diagnoses are like a bomb going off, and the shrapnel goes everywhere. And I like to say any issues that you have are at the surface. It's like they're kind of floating on top of the water after everything blows up. They're there and you have to deal with them.
And in many cases, like autism diagnosis, and especially the severity of the child with autism, in many cases with SM, it is I don't want to say an easy fix, because nothing's an easy fix, but it's not as severe as some children. So you have the gamut of severity, just like you do with autism with SM. Some kids, it's, different. So I don't want our listeners to feel that, oh my gosh, the bombs went off. Some of them, it isn't going to be a bomb. It's going to be uncomfortable.
Yeah.
And it's going to be changing your ways, because the more you're involved, the more you facilitate, the more the children make the progress and so forth. But we were talking about the energy just helping our children. But what about the self-advocacy you need to do for your child in school and in settings? That's energy draining too.
Very draining. I tell parents all the time, especially if they're parents that see me weekly or every couple of weeks just for their own mental health. If I know they have an IEP meeting coming up,
Yep.
or, a reevaluation or anything like that, I usually say, just be aware that when you see all of this on paper, it makes it so real. No matter how long you've been doing it, no matter how well adjusted you feel, you still might be struck by, oh my gosh, these are my kids' issues on paper.
Yeah. So self-advocacy with the school, fighting for rights, fighting for accommodations, interventions. But what about with certain, I'm sure you must have had some of this, but aunts, uncles, family, friends that really don't understand your child, and the frustration and anxiety, the frustration, the depression, you get really upset because they don't get your child. So you have to advocate for them and educate them.
Yes, and it feels like you have to be like the mom, the therapist, the educator, the meal maker, you have to be everything.
You're wearing tons of hats. I love how you're describing that. I'm getting an image, because I'm very visual of just, you're changing the hat, you're changing your outfit every time you're out and about, everywhere to self-advocate for your child. And then the guilt you feel sometimes, or embarrassment, like when your child doesn't say hello or thank you.
Yeah.
We do the big 5 words: hi, bye, yes, no, and thanks. And one of the biggest challenges our kids have are greetings, and being able to say thank you. And probably one of the reasons is because of all the years of, or time saying, say thank you, say please, say hello, say goodbye. It becomes an avoidance for this population. And so the big 5 words tend to be the most difficult words to say, or even not say. Just do.
Well, because think about all of the social rules that are around those things too,
Yes.
right? So we're not just talking about the speech part of the brain, we're talking about the social part. And to be able to get those working the way that they need to say those 5 words, a lot has to happen.
A lot has to happen. Has to happen. So why self-care matters? Let's talk about this, about, in your words, how do you describe this? I know this was one of the topics you had in your Autism Blueprint podcast. You did a lot with this, and you do a lot of work with parents. So definitely putting that out there for our listeners, because I think it's going to be a valuable resource. Talk to our listeners, like talk to me about, why does it matter? You're like, okay, self-care, but why? Why?
Right,
We
right.
talked about
And
it, but why?
so when I refer to self-care, I'm not talking about massages and weekends
Yes.
away and things like now it can be, but I'm talking about the kind of self-care that we do moment to moment throughout a day. So for me, this includes setting healthy boundaries, deciding what and who in your life is toxic or not, right?
Oh,
I don't know, I'm not going to curse on here, but I had a
you can curse.
okay. So I had a therapist say to me one time when I was hemming and hawing about an event I had to go to. My kids were little and I didn't want to go. And she said, well, she told me two things. One, I don't want to is a good enough reason. And I had never been told that in my life. So I was like, oh, okay. I don't want to is a good enough reason. I'm going to take that to the bank. And two, she said, Janeen, you have enough bullshit to deal with on a daily basis to have to deal with more. So those two ideas gave me permission, to start saying no when I had to say no. I was a horrific people pleaser. I still to this
I was just
day.
going to say, we're like literally vibing, because so many things you're saying are like right here for me. And then you're like, I'm people pleasing. Oh my
Yes.
gosh. Oh
Well,
my
we're in
gosh.
the helping profession, right, Doc? I
Yes.
mean,
Yes.
this is why we just get to help, right? Or overhelp and get paid for it. So
It's interesting you said about the people pleasing and like feeling like you're making someone disappointed. I don't know if you know of this. I'm sure you've heard of Mel Robbins.
yeah, I love Mel.
So Mel, yeah, me too. She's incredible. But she came up with this theory called the let them theory. And I'm not sure I just learned about it like maybe 2 months ago, and I bought the book and I'm listening to it, and it has been so helpful because it's for me to teach my families I work with, let them have a meltdown that you didn't go to the party, but let
Yes.
me take care of myself and do what I need to do, because we all have that difficulty with disappointing and not wanting to disappoint, right? And it starts
Yes.
to eat at us, and that's energy draining.
Mm-hmm.
Self-care, energy draining.
Mm-hmm.
So I love the way you said about the boundaries. But for our listeners, I want to refer them to that Mel Robbins let them theory, because it is so easy to listen to and understand, but we don't do it. We're
Yeah.
so busy pleasing everyone, and our families get so caught up in that. Like, I don't want to disappoint the neighbor, but I don't think that family barbecue with 150 people screaming is the best place for my child on a
Yes.
Saturday afternoon after doing therapy all day. Like, we need to decompress, or
Yes.
whatever it is. Or going to a specific birthday party, of the big roller rink when there's a million people there. That may not be the best place to take the child. Maybe you do that. You know what I mean? There's so many
Yeah.
different things. You have to make decisions, but you're so worried about disappointments, of
Yes.
disappointing others.
Oh, and I especially get this during the holidays, and I know it's not that time right now, but anything that comes up, birthday parties, holidays, anything like that, I say to families, what works for you? You have to figure out what works for you, what works for your family, and don't make any apologies for that. You get to say to your in-laws or whoever, you know what? Thanksgiving at your house isn't going to work for us this year. We're going to spend it at home and we'll see you next time, or we'll see you for dessert, or whatever it is that will work for your family. You don't owe anyone an explanation as to why you're making the choice you're making.
Yeah, so there you go. I mean, the oxygen mask analogy, I love that one too, right? Like, if you're not taking care of yourself and your needs and your family's needs,
Yeah.
then you can't do anything for anyone.
100%. And it's when I was training to be a therapist, I was taught you can only take your clients as far as you've gone.
Interesting.
And I think that a lot of that is true about our parenting as well. If we want our children to have healthy relationships, but we don't know how to have healthy relationships, there's a problem.
No, that's great recommendations. And you were saying at the beginning about letting the toxic people go, which is energy draining, in
Mm-hmm.
order to help your child, right? In order to help yourself, you got to let some of them go, because I think some of our listeners but great Aunt Bertha, like, she really gets upset when my son doesn't talk. And every time we see her, my son regresses, and it's so upsetting because she'll say, you're going to talk to me today, aren't you? And I need to say to the family, you need to have a talk with Aunt Bertha. If she isn't going to respect the boundaries, I mean, we have a document called About My Child, which we say give to people, talk to them about it,
I
ways
love
to
it.
interact, things to do, things not to do, to help you make it a successful experience for everyone, frankly. If Aunt Bertha is not going to come on board, you know what? You just don't see Aunt Bertha for a while, and you just say, look, as much as we love you, we just need to take a break because you're not getting it, and we want we want to help you understand our son or our daughter. You just may have to not see Aunt Bertha.
100%. Yeah. And extended family can be a real asset, and it can be a real burden. So just depending on who the people are, even if you're related to them, even if they're the grandparents, and I love grandparents. Grandparents are wonderful, but they don't always understand. And I always say to parents, if someone doesn't take your no as a no and keeps fighting you, they might be a little bit toxic, or you might need to set a firmer boundary. If you're a parent, you're an adult. So you have the ability to say yes, no, and what you think matters. It doesn't, Aunt Bertha can have her opinion, and we have to let her.
And this is a reason, I'm sure this is what you do in your practice, but this is a reason for our listeners, if they really struggle in these areas, because most of our listeners, we have a lot of families, parents listening, you need your own therapy. We say this to families all the time. You may need support. It's not just follow these directions. It's you may need support to get through these situations, and that's fine. So having your own therapist to work through your struggles and to help you navigate these difficult situations, because that's going to help you be able to function.
100%. And whatever you came into parenting with is still there. So if there's unresolved stuff, it's going to show up in some way.
So let's, for our listeners' purposes, let's talk about some practical self-care strategies that you recommend, and then I can jump in and stuff like that. What are some self-care strategies? How do you start developing self-care strategies?
So where I start with people is usually to say, to make sure that they can read their own physical body cues, right? So we all hold feelings in our bodies, and sometimes we're in tune with it, and most of us are not in tune with it, right? If I get angry, for me in particular, my chest gets red and it goes all the way up to my ears. If I'm feeling sad, I might have a knot in my stomach, so to be able to identify what you're feeling is where I start. It's the same place I start with kids, but I start with the parents too, because as a parent, if you're not feeling right, and you can kind of stop for just a moment and do a body scan and be like, okay, what am I feeling? Where am I feeling it? For me, it would almost always be in my neck and shoulders that I would just hold so tightly all day. And then I would have to tune into it to drop my shoulders, to unclench my jaw.
Do you recommend meditation a lot for families to start, or listeners to because one of the things I recommend, because I love what you said, and that's what I do, pay attention to your feelings. What are you feeling? Are you getting a headache every time you're around someone? Like you said, you get red in the face, you might feel anxious, you don't feel good, your stomach hurts, you get an upset stomach. But calming yourself in those moments, do you recommend meditation? And if so, are there specific apps you love?
I use YouTube a lot when I recommend meditation, because it's such a personal thing. Some people love having silent meditation. Other people love to have music or singing bowls. Other people need a guided meditation. So, and I usually tell people, mindfulness can be just for 5 minutes in a day. It can be woven into the things that you're already doing. But it's a matter of shifting perspective, right? And I know this is hard. Believe me, I know that I have a kiddo that I have to make sure doesn't, get too far away from me, because he could go, running down the street. He doesn't really know how to keep himself safe all the time. So, these moments can be fleeting, but I start with my patients with, okay, if you're in the car, this is the best place to start mindfulness, right? How often do we drive somewhere and not pay any attention to what's going on? Just being really intentional. What do I want to listen to? Now, sometimes we don't have a choice, right? Because the kid in the back seat needs to listen to their thing over and over and over, or whatever it is. But just being aware of the temperature, the sensory stuff, right? I do an exercise every time I get in my car where I take a big breath. Breathing, we forget how to breathe, right? Take
Yeah.
a big breath in, like you're filling up a balloon through your nose, and then blowing it out your mouth like you're blowing through a straw. It immediately brings your heart rate down.
Yep.
And so sometimes we need to do something physical like that. Going for a walk is
My favorite thing that I do
fabulous.
is the walk. I
Yeah.
put either I'm listening to an audiobook to disconnect me because I love the sounds. I don't love silent
Mhm.
meditation. I'll lose my mind. But
Mhm.
like you said, there are others. So listening to music, doing a Peloton walk, just doing music walk, just walking, looking at nature, looking
Yeah.
for things, just disconnecting in itself is a form of self-care.
100%. Because if you don't, your brain's going to do it for you.
Yeah, you're right. You're going to shut down and you feel it. Like, we're adults. We can figure out, you know what? I know how much I can deal with in a day. I know how many patients I can see. I know how many times I can socialize in a week. I know what I need to do, but kids don't know that. So they will act out behaviorally. And
Yes.
so one of the difficulties our kids have is, as you see, as you know, emotional dysregulation. So
Mhm.
one of my favorite things to do is I say to families, I need you to journal when they are having this dysregulation, the difficult, challenging behaviors. What happened right before? Are they hungry? Are they tired? Are they overstimulated? Understimulated? Are they frustrated by something? Is sensory? What preceded that dysregulation, that difficult, frustrating behavior that you're trying to tell them to stop doing without realizing, hey, this was an easy fix. They need a snack at 3 o'clock. Or, you know what? The mower is out there really loud and the child's like overwhelmed and they can't focus on what you're asking them to do and they melt down. Like there's a
Mhm.
number of things, but parents like focusing in on that, the same with themselves, right? Having that way of knowing what I can and can't do. So I think it's important for our listeners. We're talking about self-care, but one of the reasons we need self-care is to be able to help these kids manage their difficulties, their emotional dysregulation. You're always on cue for.
Oh, 100%. Yes. And if we can't identify for ourselves how we regulate, then
Right,
we can't
exactly.
begin to help them.
Right.
Right. And unfortunately, I had to do it backwards because I had no idea how to regulate my emotions. I didn't know that was a thing. I just, I grew up in an Italian family and everybody yelled at each other.
Yeah.
So, I mean, that's how you handled it. So,
Right.
so I had to learn some things. I had to learn some new habits. I had to learn in my marriage as well. And my husband would say he had to learn as well. But I would love it, even if a parent could just be a little more intentional about the things that they do during the day, what they eat, what they put in their bodies, when they do it. Just that there's a whole intuitive eating, idea now, which I've really enjoyed looking into because it talks about knowing your signals in your body, knowing when you're actually hungry or when you're bored and, things like that. But most of us don't know how to do that.
Yeah, no, that's a good idea because sometimes when people are self-care, they're either not eating, like you said, like they're emotionally dysregulated themselves. They either don't eat or they eat.
Yes, yes. So having a plan, right? If we can anticipate something, we can plan for it. And as humans, we do the same stuff all the time, pretty much, right?
I
So
would
if
say
we, Mhm.
no, absolutely. And one of the things that I think about is like you mentioned meditation, and I don't want to forget is I like the box breathing
Oh
that
yes,
you basically are talking about when you get in the car, where it's like you breathe in, you hold for 4 seconds, you let out for 4 seconds, you breathe in for four. Like that's similar to what you're saying. So that's like an emergency calm for a lot of parents. That
yes.
sort of I don't have my app right in front of me. There's a million apps. You said YouTube. But just having something, you do the deep breath in, like something that in the moment you feel yourself being dysregulated. The box breathing is a really good tool that I've taught families. I use box breathing when there's a lot going on. I'm like, okay, calm yourself. So that's one thing. I like the fact that you talked about like your like almost like daily routines, right? That's kind of what you're talking about.
Yes, yes. So because I know for me, if I'm having a really stressful day, I will tend to either not eat or just not eat much. And so I have a backup plan for myself because I also know my blood sugar can be dysregulated really easily. So because I know this about myself, I have a plan. I always have a smoothie, like a prepackaged smoothie in my refrigerator at work, so that in the event that I can't eat something, can't stomach it
What
or whatever,
smoothie? Do you make it or do you buy it?
I just buy it.
What is it?
I do different ones. I do the naked smoothies sometimes. I try to get them that don't have sugar and things like that, that have fruits and vegetables in them, but just something that I know that I can ingest to raise my blood sugar, to give me some nutrition. I mean, nutrition's so incredibly important. You know that.
Yeah, no, for sure. And I think you're right. Parents can go like a whole day and realize I haven't eaten because I've been so busy doing everything. Having that like emergency pack of like a meat stick or a turkey stick, or
Yes.
having hard-boiled eggs around, or in work, like we have a refrigerator that all of our staff have like their stuff to grab. But I like the smoothie. They have those prepackaged smoothies like Core Power, although I'm hearing, maybe there's like certain ones obviously are going to be better for others. And then
Right.
there's one that I like called Kachava, which
Uh-huh.
is like this mix, and it comes in different flavors, and you make it at home, you can bring it in. But having those quick drinks, even for the
Yeah.
kids, because a lot of our
Yes.
kids, they're hungry, they can't express it, having these quick things to give them to bring their sugar back up.
Oh yeah, it's amazing how many parents don't think about blood sugar, and it being, even if your child doesn't have blood sugar issues per se, if they haven't eaten for a while, their brain isn't going to be working on all cylinders.
And some of our kids don't eat in school well, right? They have eating issues, the social anxiety component, the sensory component. And then they come home and they're busy running, and all of a sudden they haven't eaten in 6 hours. And the parents are wondering, why is my kid having a meltdown? This happened probably within the last 2 weeks. I had a family that would just be like, every day after school, she's freaking out for no reason. We started doing an inventory, and the child wasn't really eating lunch. And it was like, they weren't eating. And no one really brought that attention until the parents started doing the research. And then we had to have snacks in school. All of a sudden that disappeared. Something
Yeah,
so
right.
simple.
Sometimes the solution is so simple.
So simple.
Yeah,
And I
but not
love,
easy.
yeah,
Simple, but not always easy.
no, for sure. I like the scheduled parent breaks. Like if you have a partner, like you take your break, they take their break,
Yep.
so that you can, that's a great thing. Like the socialization is really important. I mean, there's so much research. Look, there's different types of people, right? There's the introverts and the extroverts. I personally get energy around people,
Right.
but a lot of our families we work with, because SM tends to be related to the social anxiety component, they may be more introverted. So they are busy with people. Their self-care is not being around people. So it's knowing yourself, right? There's no one size fits all. Hey listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description, or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode.
Yes, 100%. And who I was when I was a new mom is not the person I am now that I'm in my 50s. So my likes and dislikes have changed. The way I re-energize myself has changed, things like that. And I've gotten to know myself along the way. So I just want to encourage parents, rather than thinking you have to do something the way somebody else does it. This is a great example. A lot of times my mom or my mother-in-law would get me a gift certificate for a massage, and I would go do the massage, and I hated it.
Oh my gosh, Janeen, I don't like it either.
Isn't that crazy? I hated it. And I don't want people touching me
I am
unless
the
I have a
same way.
relationship with you.
I can't stand it. Like, don't give me that as a gift.
Yeah, but
That's
you know what?
stressful.
And I did it thinking that maybe there's something wrong with me. There must be
Yes.
something wrong with me. I'm way too uptight. I must need 5 or 6 of these massages.
Yeah.
Until I finally just went, I don't like them. And please don't buy them for me anymore. You know what I do like? And we have a we call this a hotel by myself night. And I do it
Oh,
every couple of months and I do it every birthday. And it happened one time because my husband and I planned to go away on my birthday and it fell through. Like our babysitter fell through, or I don't know if my son wasn't doing well at that time. We decided we couldn't both go. So I just went and I had the best time. And so now I realize I need that downtime. I need a nice hotel with room service. And I just want to chill and do whatever I want to do. Sometimes I don't even watch TV. Sometimes I just enjoy the quiet. And then other times I just sleep. It's just, when do you get to do that and just focus on you? So my husband and I made it a habit where he and I would take turns doing things like that. And then eventually, when my son was able to travel, we started traveling together and things like that. And we do road trips a lot. We at least try to do one a month because he loves it so much.
so a couple things. I say to parents, whatever you're feeling, if it's distressful, do the opposite. If you're feeling sad, because you're going to feel sad, like we're humans,
Yeah.
you're going to do something that makes you happy and have a list. So make a cheat sheet for all of these things so that when you're in the moment, you can't think of it, go to your list. So things that make me happy when I'm feeling sad: 1, 2, 3, and 4, and 5. When you're feeling really like whelmed and wound up, what are the things that bring you down, like not make you sad, but have it kind of lower that energetic, overbearing feeling? Have a
Yeah.
list of 3 to 5 things that you don't even have to think about. You just go to that list and go, oh, you know what? I'm gonna put a text out to a few of my friends to have a girls' night out. That makes me happy. Or who's available for dinner tonight? I
Yeah.
just need to go out. Or, oh, I'm gonna look at the YMCA and see what classes are tonight because I know that I need to get out. How do you feel about that? Because those cheat sheets have
Mm.
really helped a lot of people.
Yes, cheat sheets are fantastic. Also, pictures are helpful. So I'm a trauma therapist as well, and one of the interventions that I do with people, and this is an evidence-based intervention, is that if you have a picture, a real picture or one in your mind of a calm place that makes you happy, right? So I have a picture in my phone of a sunset in the Blue Ridge Mountains where we like to go. And this one time, there was just this gorgeous sunset, and I took a picture of it and I've got it in my phone. I made it a screensaver for a while, but it's a picture that I can look at that will immediately change my body at that time.
I love this. You know what? I intuitively do that around my house. I
Uh-huh.
have pictures of moments in my family's life, whether it's my children's recent wedding or it's like swimming in the pool and they're all smiling. And I
Yeah.
just find myself naturally looking at that and the joy I feel. I even have this rotating photo album. Sorry,
Oh,
it's like a frame.
love that. Yes. Switches the pictures.
Yes, it's called Aura,
Neat.
Aura, and one of my daughter-in-laws got that for me for Hanukkah. And literally it just switches. So I take my favorite pictures on my phone, I send it right to the Aura frame. And at night, sometimes I'm just sitting there and I just notice it. I'm not even like stressed. That brings me back. So I love this, and it's definitely for our listeners a really great way to just self-care in the moment. You're sitting on the couch, you're kind of like not sure what you're going to do, and you just look at these visuals. I love this. Thank you for like
Yeah.
bringing, like, now I know why I'm doing it. It comes.
Yeah. Yeah, well, and it's research based that when they've shown that when people look at a scene, like where people that I live in Florida, and my friends that live up north are always like, "Oh my gosh, we can't wait to get to the beach." And I'm like, "Well, here, have a picture of the beach." And they laugh, but I'm like, "No, really. Like this will literally make your brain and body convinced you're there."
Yeah.
And the more that you can look at that picture and use your imagination, right? Let's not forget, as adults, we still have imagination. It's that imagination that makes us worry about things at 3 in the morning that will either never happen or that we don't have to worry about at 3 in the morning. We use that imagination to build that safe place. I call it a safe place technique. And you think about what your five senses, right? If I'm sitting at the beach, what's the ideal weather for me? Where is the sun? Is it a little behind the clouds or is it bright? Are there other people around? What do you smell? What do you hear? And if you can build that scene in your head, your body will follow.
Yeah, no, for sure. Everything you're saying, I'm looking over my list and we've covered so much of it, like the importance of socializing, recognizing and navigating burnout. Like you said, like what do you do for that? Like burnout. You're actually burnt out. You pass the point of it's not in the moment changing it. It's like I'm really burnt out. And I think your idea of going to a hotel may work for some of our families. Just deep, like just getting out of the house, evenings out, just deep, like literally like kind of going away and really recharging. And sometimes it can take a little time. Like you said, once a month you're going away. It's not just for your son, I'm sure it's for you. Like it re-energizes you.
Yes, yes, it does. Even though traveling with my son is its own stressor, it's a different kind of stressor than just being at home. But, and I don't want to take up a lot of time with the story, but a few months ago, I really had to practice what I preach. It was really challenged for me. We were up in North Carolina when Hurricane Helene hit. And it was, for those of you that don't remember Hurricane Helene, it devastated Asheville.
Yeah.
And we were in the Asheville Mountains. We were in Waynesville, and we left the morning after we realized everything was decimated. But we didn't know. I actually have a podcast episode about this, one of our recent ones. We didn't know the danger that we were in, and we had to try to get off the mountain after the storm had hit and after all the houses were floating by and things like that. Needless to say, I left that situation for whatever reason. Out of my whole family of 4, I was the one that was affected the most. And like I said before, if you don't deal with it, it will deal with you. My prefrontal cortex of my brain, the part where you do all of your planning and your, daily activities, it just shut down. I came home like a zombie. I just was like, what is wrong with me? Well, as a trauma therapist, I knew what was wrong with me. I had to go get some help. Yeah. So I did it immediately. I immediately got back into therapy. I took anything off my schedule that didn't need to be there. And God bless my family. They're amazing. My daughter, who lives with us right now too, was cooking dinner every night. My husband was like, what can we do for you? It was a very weird position to be in because I have never been in this position. I'm always helping everybody else. And this time it was just, the stress had bubbled over and basically it wasn't a bucket anymore. It just had broken the bucket. You know what I mean?
Yeah, no, recognizing that. And it just put you, I'm sure all the danger potential and what could have happened, like just exhausted you.
Yes, yes. And thank goodness we were okay and everything went as well as it could. But we were in a car for 9 hours trying to go around trees that had just come down and nothing was cleared yet. And, it was really awful. And then having 2 children, one of them with severe special needs with me, was a lot. So I think just being able and knowing what I know, I think, about trauma and about the stress that I already lived with was helpful because as soon as I got home, I was like, I know what I've got to do. And I got back into my own treatment. Yeah.
I think a real good take home for many of the listeners is you need to create your lists.
100%.
Your list of self-care, what brings you up, what you need to do to mellow down. Like create your own. It's not like yours is going to be the same as mine.
That's
although
right.
We both love those pictures. I mean, I'm looking at them now from where I'm at. I've got so many of wonderful times in my family's life that just brings joy. And I think a lot of our families, something so simple as that, right?
Yes. Yeah.
Sometimes it's not that complicated.
That's right.
So I think, to me, like, is there any, like, there's so much to talk about with self-care, but I think one of the reasons we need it, not just for ourselves, but how we can be a good parent, a good partner, a good clinician, a good friend, a good child, a good brother or sister. Like, in order to be able to be all of those things, we need to have our oxygen and we need to be functioning. And we're going to have moments, we're human, but it affects your family. Like, so many times you see families that are so stressed, so anxious, and their children are going to feel that energy. Like, so many of our kids are sensory sensitive. highly sensitive people, they're absorbing your energy. So
Yeah.
they're not going to be happy campers either when you're stressed out.
100%. Yes, they're going to take their cue from us, which sounds like a lot of pressure, but it forces us to take care of ourselves.
Yeah, exactly. The words you use, the volume you use, just how you're presenting also teaches them how to deal with stress too. If you're freaking out and, I had a family recently where the parent I think it was the father, got so frustrated he threw something on the ground. Well, the next day, what do you think happened with the child when he got frustrated? He took something and threw it across the room and broke something. I think it was a china bowl. And the parent called like all upset, and they're like, I don't understand. This is what he did. And we started talking about it. Turns out that's what dad does sometimes and had just done the previous day just because he was frustrated. So he needs some help with self-care and how to help himself. But our kids are going to model us. They're going to use us as examples. So it's something so subtle, but it's so true.
Yeah. Yeah, absolutely. That's such a great point.
Any we can talk forever. Any last minute sum up in your words, self-care?
I just would stress to your listeners, when you're doing these little things, I often feel this, but I hear it a lot from my clients as well. They think, well, what is this little 15-minute walk going to do? I need 3 weeks on an island somewhere with nobody bothering me. And I say, yes, I hear you. And I would love to go there with you. However, little bits do make a difference. And I just remember when my kids were little feeling like, well, it's just so much work for me to have to even go out of the house for a couple of hours to make sure everything goes the way I want it to. Let go of the way you want it to. It's okay. You can't have it both ways. You can't have things go perfectly and take your break at the same time.
Yeah, no, that's right. It's the little things that add up to the big things. I would say one of my kind of tidbits to our listeners is I really am big with create those sheets of those, like on your notepad, a list of things, making sure if socializing gives you energy, make sure you have plans to look forward to do, doing that, exercise alone. People undervalue the importance of, I remember learning this in med school that exercise is an antidepressant. It's it's so effective. It's an antidepressant. And so for so many of the families we deal with, they'll get down, they get frustrated, they get overwhelmed, and movement alone just brings you up those endorphins. And so I would say that all of our listeners need to have some sort of exercise program in general, because when they're not doing it is when they'll realize, wow, I'm not feeling myself. I'm feeling low energy, because you're out of your routine. That brings you up. That gives you a level field, and it helps you decompress. It takes it out. It's whew. Even though in the moment you might be tired and it's oh, I don't want to do it, but you do it. So having these routines, these schedules, and also the predictability of your life as much as you can, the structure, consistency, routine, and predictability in their lives helps their children. The schedules of knowing what, when, and where instead of everything in the air. That's also very helpful. And really utilizing therapy and support groups,
you know? Yes. And that's it. We have, I've been running a support group for moms since 2008.
Is it virtual by chance?
It's been in person, but virtually what we're launching now are some Discord groups, and they're just about to launch. So maybe by the time this one goes out, come on over to autismblueprint.com.
What is it exactly? What is it exactly?
We're going to have virtual groups. Your listeners that have used Discord before, which is new to me. I'm learning it. My daughter's teaching me how to use it. It's basically just a platform where people can either anonymously or not anonymously meet up, and so we'll have different chat rooms. Back in the day when we had chat rooms, when the internet first came out, that's kind of what it's like. And we'll have free ones, and then we'll have also paid ones for more things like webinars and things like that. But I wanted to recreate what we've been doing in the office online. So we are going to have support online coming up.
No, that's great. And knowledge is power too, right? And utilizing support groups. I mean, the statement, I hate to use it, but misery loves company. It's like if you're feeling really, I'm feeling so alone, I'm so frustrated. I mean, when we do our communicamps, one of the things that's so wonderful is that social identity connection, being able to identify with someone else that has something similar going on makes you feel better, because you're not the only one, instead of thinking and funneling into this downward spiral as I'm the only one and the negative self-talk. And that's another thing. Get rid of negative self-talk. Every time you're like, oh, I'm so dumb, or I'm stupid, I shouldn't have done that. Like, stop it. You're like bullying yourself. So stop that right away.
Yes, yes. Self-compassion is important, really important.
All of these things come into play to, for our own self-care, for sure. And a good trip to Disney World every now and then with all the fun music, like, I highly recommend it. I jokingly write prescriptions for some of the parents, like, go on a vacation, do this, do that, do a date night, like date nights, right? You probably had to do that with your husband, right? That's so important.
It is. It really is. We've even had date nights where if we couldn't get a sitter, we would put the kids to bed and then have dinner by ourselves, just, out on the back porch or whatever. Just,
But
you might
that's
have to get
self-care.
creative.
It's self-care for your marriage.
100%.
Right?
Yes.
In your relationship. So that's so important too, is self-care for that. So it's not just yourself. That could be a whole nother podcast, is self-care with a relationship, right?
Oh yeah. Oh yeah. That's a whole other thing. And if you're lucky enough to have a partner like me, I have a really good partner. I'm very lucky. I mean, we've worked on it, so it's not just luck, but we've learned how to check in with each other.
Yeah, for sure.
How are you doing today? Do you need a break? Do you need something else? And so that's how we spend our weekends now, where I say, okay, what day this weekend do you want a break? And then I'll get a break on the day that you don't.
That's great. I love that.
And
That's wonderful.
we have to. You just
Through
have to.
partners. And having children with a challenge, a disability, is definitely not a great recipe for a great relationship unless you work at it, because it can pull you apart.
Yeah, it can.
You have to actually be on the same team, else that's not good. So this has been wonderful. I thank you so much. And in our notes, we're going to have resources for your podcast, your website. Send us, information on your virtual groups. We'll definitely put that in there. And I'm looking forward to being on your podcast.
Yes, I can't wait to have you.
Yeah, it'll be super fun. So think of some great topics, like after I don't know if you have any in mind, but I'm excited.
Oh, I think we could probably fill an hour, no problem.
Oh, absolutely. We're absolutely. So thank you so much. I look forward to connecting with you soon. And where are you in Florida again?
I'm in Jacksonville.
Oh, you're in Jacksonville.
So we're up in the north part of Florida.
Okay. I go down to the South Florida a lot. So not a lot, but more than Jacksonville area. But so this has been great. And we certainly have families in Florida that can look you up and hopefully come to you, because you're wonderful.
Thank you. Thank you so much.
Thank you, Janeen.
Thank you. Thanks for having me. Appreciate it.
Bye.
Bye-bye.
Thank you for listening to Unspoken Words, a Selective Mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask-DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at unspokenwords_podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.